Hello everyone, thank you for joining today's webinar. Today we're going to learn about exit interviews and the brand new harmonized end-of-life dataset built by the Gateway for the Health and Retirement Study in the United States and go through a sample analysis focusing on this new data. I'm Jenny Wilkins and I represent the Gateway to Global Aging Data out of the University of Southern California. We would like this webinar to be interactive, so if you have any questions or comments during the webinar, please feel free to use the chat box. There's also a handout provided for you, which is called Advanced HRS EOL Webinar March 2019.doc. You can download that in the handout section of the GoToWebinar panel. This is actually a Stata-Do file, so you can download it and remove the C from the extension and run it in Stata. So first, Jennifer Alshire from the Gerontology Department at USC will give us an introduction to the HRS exit interview and to some of the variables in our new Harmonized HRS end-of-life dataset, along with some next steps for these datasets. Then we're going to do an analysis using the Harmonized HRS end-of-life, and we'll also use core interview variables from the RAND HRS and the Harmonized HRS. The RAND HRS is a user-friendly version of a subset of the HRS core interview data, which has existed for years and offers an extensive number of variables. The Harmonized HRS was first released last year by the Gateway and is meant to be a supplement to the RAND HRS, having core interview variables that the RAND HRS doesn't already have. Now, I'll hand it over to Jennifer, who will give us some more information.
Hi everyone, I'm really excited to be participating in this webinar today. I've been using HRS exit interview data to study end-of-life issues for several years now. I will say it's a fairly challenging data set to work with, and so I think that the harmonized end-of-life file that the Gateway is providing is going to be a real benefit to anyone who has already been working with the data or who would like to start working with the data. So I'm just going to give you some background on what the exit interview is, because it is a bit different from the core interviews that are conducted by the Health and Retirement Study. The exit interviews are attempted with a proxy informant for any of the HRS respondents who have died. The proxies might be the same person as who provided a proxy interview in a prior wave, but to the extent possible, the proxy informants are knowledgeable people who can speak in detail about the health, family, and financial situation of the HRS respondent prior to their death. The content of the exit interviews are actually quite similar to what you would find in the core interviews. The main differences are that there is some additional content that's specific to end of life, and of course, some questions aren't asked if they're not relevant to end of life. The information provided in the end-of-life interviews can be used to answer questions about the health status, the medical care that was used, expenditures at end of life, how assets are distributed among the family members following death, and also importantly for many folks to understand the kind of decision-making that occurs at the end of life. The advantages of the harmonized HRS end-of-life data are primarily in the fact that now you have one file that contains all of the exit interviews that have been conducted over time. So you don't have to do a lot of merging. Everything is provided in that one data file. Another major advantage is a really consistent and intuitive naming convention over time. If you've worked with the HRS exit files before, you will have found that if you go far enough back in time, that there isn't consistent variable naming. And this is the same thing is true for the core interviews. So having that consistent and intuitive naming convention is very helpful, and it does really speed up time to analysis. One of the innovations of the harmonized end-of-life data is that we've created some additional variables that would be helpful for people who are studying issues at end of life. One example is that we created a variable that tracks time from death to the exit interview. And I'll show you a little bit of information about what that timing looks like. But this might be important for analyses that might be conducted and to understand the length of time that elapsed from death to the interview so that people can understand what the quality of the memories might be of the proxy informants. Another useful feature of this file is that while one file has been created with all of the exit interview, a user might want to link the exit interview data back to other information from the core interview. So there are linking identifiers in the file, which Jenny will show you about in the second part of the session, that you can use to link the end-of-life data file with the core HRS files, the RAND HRS, and also the Harmonized HRS that's provided by the Gateway. Now, of course, the main feature of this file, which has yet to be realized, but we're working on at the moment, is that these data will be harmonized with other surveys in the HRS family of studies. So today you're learning about the HRS, the United States HRS, but I'll tell you at the very end of my presentation about some of the other surveys that we are in the process of harmonizing. So that's a main advantage of the Harmonized HRS end-of-life data, that people will be able to do cross-country comparisons much more easily. So as I said, the content in the exit interviews and what we've included here in the Harmonized HRS end-of-life file, it's really similar to what you would find in the core. What we've provided, though, is a little bit of mapping for you because the sections aren't labeled quite the same. So for instance, what you find in this table on the left side are the sections in the Harmonized HRS end-of-life file compared to what we had in the HRS exit interview. So you can see how we changed some of the letters that are used to designate the sections. But just like you would find in the HRS core interview, there's a section on demographics, on health status, healthcare utilization and insurance, financial and housing wealth, employment history, assistance in caregiving, and end-of-life planning. You'll notice some of the sections that you would find in the HRS core are not here in the HRS end-of-life file, and that's because those sections don't exist in the exit interviews. But also, it's important to note that what we've provided today are a subset of variables from a subset of sections that were selected in order to maximize the harmonization across the HRS family of studies. What this means is that there are some variables in the exit interviews that are not included in the Harmonized HRS end-of-life. So you'll want to look at the code book to see what's actually in the Harmonized HRS end-of-life file. And of course, if there are variables that you're interested that aren't in that file, as I said, that there are linking variables that you can use to easily link back to any of the other HRS files. Someone has asked if these slides will be available after the webinar, and the answer is yes. They will be posted to the Gateway website. Please feel free to ask any questions you have. So I've been talking about the exit interview, which is an end-of-life interview conducted with HRS respondents who have died. But the HRS actually conducts several exit interviews with a subset of respondents. So you might see some language that refers to post-exit and post-exit interviews. Post-exit interviews are conducted with proxy respondents if after the initial exit interview, there remain some unresolved financial situations, such as those that might be related to the final adjudication of wills, trusts, and estates. A post-exit interview is then conducted if there continue to be unresolved financial situations from a prior exit wave. It's important to note that these post and post-exit interviews are really only asked about financial and estate questions. If you're interested in how estates were divided up after death and what happened with the final adjudication of an estate, which can take some years after a person's death, you will want to consult the post-exit and post-exit interviews. If your interest in end-of-life research is not in the final adjudication of wills, trusts, and estates, you probably don't need to focus so much on anything besides the initial exit interview. And in fact, we don't conduct that many post-exit interviews. This table is a distribution of the number of HRS respondents for whom HRS collected an exit interview, a post-exit interview, and a post-exit interview by wave. HRS started conducting exit interviews in the second wave, but not that many people had died because this was the original HRS sample, which was quite young, approximately 51 to 61 years of age. And it wasn't until the fourth wave of exit interviews that the number of HRS decedents had grown considerably, and it maintains somewhere around 1,200 to 1,300 people per respondents per wave who are interviewed for the end-of-life questions. The post-exit interviews started in wave 4. And the post-exit interviews did not begin until wave 6. So again, if you're interested in these end-of-life financial decision-making questions and you're interested in the post-exit and post-exit interview, you should pay close attention to the timing of when the post-exit and post-exit interviews begin. In total, almost 13,000 exit interviews have been conducted as of 2014. We will be updating very quickly to the 2016 data, and that will be released through the Gateway website. You will also note that many fewer post-exit interviews are obtained, only about 1,700 or so, and very few post-exit interviews are necessary to get that final bit of information. As I said before, HRS attempts to conduct an end-of-life interview with all deceased respondents. But not all respondents have an end-of-life interview. However, having said that, you can see from this graphic that the vast majority of HRS respondents who have died, the Health and Retirement Study has obtained an exit interview. The dark blue bars show all of the respondents across the study waves who have exit interview information. And the smaller green bars at the top show the number of respondents for whom HRS has not collected an exit interview. Now, HRS is always attempting to collect that exit interview, and so some of these folks for whom they have not yet conducted an exit interview may still get an exit interview conducted. But I think it's safe to say that those folks in the green bars in 1992 and 1993 will probably not ever have an exit interview conducted. You will also note that in 2012, 2013, and 2014, there are no green parts on top of those blue bars. That's because the people who died in those years will have had their exit interview conducted starting in the 2016 wave of data collection. So when we update the Harmonized HRS end-of-life file to include the 2016 data, we will include those exit interviews that were conducted for those folks who died in 2012, 2013, and 2014. But this is all just to say that something around 90% of HRS respondents who have died have completed exit interview information. The HRS tries to conduct exit interviews in the survey interview wave immediately following the death of the respondent. This graphic shows on the y-axis, that vertical axis, the year of death of respondents in the Health and Retirement Study. The x-axis shows the exit interview wave. What this is showing is that, for the most part, the majority of exit interviews are conducted either in the immediate year in which the person died or the next calendar year, but that they're generally conducted in the next survey wave. So for instance, if we look at the folks who died in 1998, you can see that 250 respondents who died had an exit interview conducted in wave 4 in 1998. That means that while HRS was in the field in wave 4, they determined that a respondent had died and they were able to conduct an exit interview with a knowledgeable proxy in that same interview wave. But actually, the majority of the interviews are conducted in the next wave, in wave 5, typically because the death either occurred at the end of the survey interview period or HRS wasn't able to ascertain death status in the wave 4. So they followed up in wave 5 and they conducted many more of the exit interviews. And then, of course, anyone who died in the intervening 2-year period, so those deaths that occurred in 1999, those exit interviews couldn't be conducted until 2005. HRS does collect exit interviews for any respondent who has died, regardless of age. But most of the deaths occurring to HRS respondents occur in the 70s and 80s. This graphic just shows the distribution of exit interviews that have been collected by age at death of an HRS respondent. There are HRS respondents who die in their 50s and 60s, but the bulk of the exit interviews have been collected for people who died in their 70s and 80s. So the age distribution of the respondents who are represented in the end-of-life interviews are a little older than the age distribution of respondents in the core HRS sample, which of course makes sense because the end-of-life sample is a sample of people at the time of their death, essentially. As I said, HRS tries to conduct these exit interviews with what they consider to be a knowledgeable proxy. The most knowledgeable proxy is undoubtedly a family member, and in fact, the HRS conducts most of their exit interviews with a family member. The larger pie chart on the left is the proxy relationship to the respondent for the main exit interview. The bigger portion, 47% of the proxies, are a child of the respondent, but 34% are a spouse, and other relatives make up 14%. So 95% of the proxy respondents are related to the deceased HRS respondent. That 5% of non-related proxy respondents tend to be caregivers or people working in the institutions in which a respondent died. The distribution of the proxy respondents by their relationship to the deceased HRS respondent is very similar in the post-exit and the post-exit interviews, as shown in the pie charts on the right here. The overwhelming majority of proxy respondents in any of the exit interviews are family members. So I'm going to answer just a few of the questions that are coming in. One question is whether only one proxy respondent is selected per deceased HRS respondent, and that's correct. If my memory serves, I think about half of the exit interview proxy respondents were a proxy respondent in the prior core interview. So there's a lot of consistency in who the proxy respondent is. But there is only one proxy respondent, so only one person completes the exit interview. That person may receive assistance from other people in the household, of course, during the interview, and the HRS interviewers note when someone else was present and helping to provide information. But there's only one proxy per deceased HRS respondent. Proxies are chosen for the exit interview in the same manner that they're chosen for the core interview. The interviewer has a household listing, asks for someone in the household to complete the exit interview. As I said, the preference is to conduct the exit interview with the proxy from a prior core interview if there was a proxy in a prior core interview. But they conduct the interviews with whichever household family member is present who wants to conduct that exit interview. In terms of that small percentage of non-related proxy informants, the HRS interviewers are tasked with identifying someone who is, as I said, a knowledgeable informant. So some of the people for whom HRS was not ever able to conduct an exit interview, the case was probably that they could not find a knowledgeable proxy informant. So there's a question about data access. I'm going to leave that for Jenny Wilkins, who will be able to talk to you more about how you would access the data and how you would use the data. So I'm just going to continue with these last few slides that describe the exit interview. So what we've done so far is create a harmonized file only for the health and retirement study. But as I said, the objective is to create cross-national harmonized files that can be used for conducting cross-country comparisons. So we will be creating harmonized files across the HRS sister studies. We're currently working on SHARE, which is the survey of health and aging and retirement in European countries. The next set of studies we are going to work on harmonizing include ELSA, which is the study in England, and MHAS, the study in Mexico. After we have created the harmonized files across this group of HRS family of studies, we will then start working on harmonized files for Charles, the study in China, CLOSA, the study in Korea, and JSTAR, the study in Japan. Additional expansions to the harmonized HRS end-of-life file will include including some additional sections. So there is a section in the exit interview that's labeled cognition. It is not an actual cognitive assessment like we have in the core HRS interviews, obviously because the respondent has passed away. It's really more about asking the knowledgeable proxy informants about any memory declines or cognitive impairments that may have occurred at the end of life. So it's labeled cognition, but it's not cognition in a strict sense. We didn't include that in this initial data release because this is in that set of variables that is not as comparable across the HRS family of studies. But in addition to creating the harmonized files across other studies in the HRS family of studies, we will be adding variables that perhaps can only be harmonized across 2 or 3 of these studies. The file that you have today maximizes harmonization across a range of variables across a number of these studies in the family of studies.
So we're going to do something a little different than in our past webinars. Today we're going to ask 2 research questions and do 2 brief analyses to give you a better idea of what this new harmonized HRS end-of-life dataset has to offer. First, we're going to ask if there are gender differences in cancer deaths across death locations. For this, we'll look at variables indicating the cause of death and where the death actually occurred. Then we're going to ask what factors increase the likelihood of having a living will at the time of death. A living will provides written instructions about the type of medical treatment or care someone wants to receive if they aren't capable of making that decision for themselves. So we'll look at variables indicating whether the respondent had a living will. We'll look at the year of death, the respondent's age at death, whether death was expected, and some indicators of how healthy the respondent was. So we just got a question, will Lassie be harmonized? So Lassie is the Indian study. The data for the main wave of Lassie has not yet been released, but as soon as it is, we will be releasing a harmonized Lassie data set for the core wave 1 interview. And they will be conducting exit interviews in wave 2. And once that is complete, we will be producing a harmonized Lassie end-of-life data set as well. So in order to continue on with our analysis, the first thing we're going to need to do are to download the Harmonized HRS end-of-life dataset, as well as the Harmonized HRS and RAND HRS from the HRS website. Now, just to clarify, the Harmonized HRS end-of-life dataset is not quite available on the HRS website, but it should be very soon. So if you go to our website at g2aging.org, we have a link to the HRS website on the downloads page. The link will be the first in the top row, right here. In order to access data from the HRS, you'll need to be registered with the HRS, which is easily accomplished on the HRS website itself, or you can use our Universal Access to Study Data page by clicking here, where you can register for one or multiple HRS family studies in minutes. Then we're going to identify the relevant variables from each data set. There are several ways to do this, and I'll go back to the website to show you how the gateway can help. So if you go to the surveys page, you can search through the actual survey questionnaire for the core interview or for the exit interview by clicking on a wave and clicking on a survey module. Or at the top of the page, you can search the surveys by a keyword. For example, we'll type in memory, click on the HRS, and click on search. And here you can select the year and the core or exit interview that you're interested in. Or again at the top of the page, we can search harmonized datasets by subtopic, which will search for variables within the core datasets. Or you can look through the codebooks that accompany each dataset by going back to the download page and downloading the codebooks from the third row. I'll show you the codebook for the Harmonized HRS End of Life, which will be showing up on our website within the next few days. So this is the Harmonized HRS End of Life codebook, and we'll take a look at memory problems. As you can see, we include the variable name, some basic descriptive statistics, categorical variable codes, and we document exactly how the variable was constructed, whether there were any differences in how the questions were asked across waves, and the variables used from the original datasets. After we've identified the relevant variables, we're going to start our analysis. So if we go back to our first research question, which looks at gender differences in cancer death based on location of death, we're going to need the HRS respondent ID, which is HHIDPN, to merge the Harmonized HRS End of Life with the Harmonized HRS and the RAND HRS. From the Harmonized HRS End of Life dataset, we're going to want to look at the cause of death. And we have three variables related to cancer death: RACOD_H, RAGCOD, and RACOD-CNCR. And we're going to want to look at where the death took place, which is called RAD-LOC. From the RAND HRS dataset, we're going to want to get the gender variable RA gender. For our second research question, which looks at the factors that increase the likelihood of having a living will, we'll need to use that respondent ID again. From the Harmonized HRS End of Life, we'll look at whether the respondent had a living will, a variable called RALV will. And we'll look at several covariates from this dataset, including the age at death, called RAD age, the year of death, called RAX year, whether death was expected, called RAD-EXPEC, and we'll look at some health-related variables, like whether the respondent received help with ADLs or IADLs, called RAX-DLH, and whether they were diagnosed with cancer, lung disease, heart problems, stroke, or memory problems in their lifetime. From the RAND HRS, we'll look at the gender variable, and from the Harmonized HRS, we'll look at an education variable. So we're going to start using Stata now. And remember that in the handouts, we have that .doc file, which is really a Stata do file that we're going to open up. So we'll open that in the do file editor inside of Stata. And so that icon looks kind of like a notebook with a pencil. If you're unfamiliar with Stata, I'd encourage you to follow along. A lot of the commands will be similar if you're using a different statistical package like SAS, SPSS, or R. We do have a sample of a core interview cross-sectional analysis in SAS that we provide, which I'll show you how to find at the end of the webinar. So I'm going to open up this program, which is called Advanced HRS EOL Webinar March 2019. And if you're following along, you'll need to edit lines 5 through 8 to say what folders your data is coming from. One other thing you'll notice about this program is a command called pause. So once we start to run the program, the pause command will stop it at different points so we can look at the output that Stata has given us, then continue to move on. So we can execute or run this do file by clicking on this icon on the top right with the arrow. Let me just try opening that up again. Sometimes it gets a little messed up. Okay, there we go. So Stata has run the do file to our first pause. And when we're ready to continue, all we need to do is type Q and enter, and the program will continue running. So I'll bring up the commands on the slides where it's a little easier to see, and then we'll jump back into Stata to look at the output. So the first thing we want to do is read in the observations and variables from the Harmonized HRS end of life. So we employ the command use because we're going to use this data set and bring it into Stata. So we're going to use the variables that we identified earlier from the Harmonized HRS end of life data set. Then we're going to merge our observations and variables from the Harmonized HRS end of life with the ones in the Harmonized HRS and the RAND HRS. To do this, we're going to use the command merge in a 1-to-1 ratio using HHIDPN, that personal identifier, using the specified data set. So this is the name of the Harmonized HRS data set, HHRS_B, and the RAND HRS, which is RAND HRS 1992 to 2014 version 3. Then we're going to specify that we want to keep using our variables of interest from that particular data set. In this case, RAEDUCL from the Harmonized HRS and RAGender from the RAND HRS. And we're going to tell Stata that we do not want to generate a variable for the merge. So if we switch back to Stata, we can see that it's already read in the variables from the Harmonized HRS end-of-life dataset. And when it merged with the Harmonized HRS, we have 24,000 observations that didn't match and 12,000, nearly 13,000 that did match. This is because the Harmonized HRS end-of-life only contains deceased respondents, and not everyone who has ever been interviewed in the HRS has died and had a proxy been given an exit interview. There are obviously quite a few people who are still living who are now being added to the data set here. And then when we merge with the RAND HRS, we see that all of our observations match because all the respondents who are currently living and who are deceased are present in this data set. So now that we have a data set to work with, let's first confirm the number of people who are in the end-of-life data. So we'll tabulate or tab a variable called INXT, which indicates if they're in the exit interview in any wave. And we'll also take a look at how much time takes place between the respondent's death and the exit interview. So we'll tab a variable called RADTOIVWM to look at how many months took place between the respondent's death and the exit interview. And we'll also look at a detailed summary for that variable. So if we execute these commands in Stata, we see that we do indeed have 12,952 respondents from the HRS who have died and have a completed exit interview between Wave 2 and Wave 12, and 24,543 HRS respondents who have not. We can also see that some exit interviews occur immediately after death, and some occur years after. But the median is at about 12 months, so about a year, and the mean is about 13.5 months. So it looks like that's skewed slightly upward from some extremely high values. Now, as Jennifer mentioned earlier, if you're concerned that your research topic is time sensitive and that a proxy could forget or misremember something about the respondent, then you may want to limit your analysis based on the length of time between death and exit interview. But we're not going to do that for our analysis today. Now we'll dive into our first question. Are there gender differences in cancer deaths across death locations? To answer this, we'll run tabs of 3 cause of death variables, one detailed, one summarized, and one indicating whether cancer was the cause of death. And we'll look at the special missings for those, and then we'll run a tab of the location of the respondent's death. So we can see that our first variable, RACOD_H, has 13 different cause of death categories and several special missing categories. And cancer was indicated as the cause of death in 3,049 respondents. Our second variable, RAGCOD, collapses these categories into cancer, cardiovascular, and other. So other contains categories 2 and 3 and 5 through 13 from our specific cause of variable death above. For our purposes today, we'll use RACOD-CNCR, which indicates if cancer was indicated at all as a cause of death. There's a few more positive observations than in our previous 2 variables because RACOD-CNCR takes into account any mentions of cancer as a cause of death, when RACOD_H and RAGCOD only look at the first stated cause of death. We can also look at where the death actually took place, and we can see that the majority of deaths took place in a private home, hospital, or nursing home, and only about 10% occurred in hospice or at another location. So before we get started with the analysis, this is usually the point where we talk about weighting. However, there are currently no weights for the exit data specifically, so our analyses today will be unweighted. To start our analysis, we'll take the mean of whether death was caused by cancer, and we'll look at this over death location and gender. So if we run this, we see that about 36% of males who died in a private home died of cancer in subpopulation 1, and about 13% of respondents who are females who died in nursing homes died of cancer in subpopulation 6 within the HRS sample. So let's look at a bar graph for these means where it's a little easier to see. We can see some variation by location by mean cancer death by gender. There seems to be a much higher chance of death being caused by cancer for those respondents who died in hospice, and then private homes seems to be the next highest. It also looks like males are more likely to have died of cancer than females in all locations except for this other category. Okay, so we have a question whether there's a time frame for the weights to be produced for this file. I can tell you that we at the Gateway do not plan on producing any weights, and based on a presentation by Amanda Sonega that we heard yesterday, the HRS does not have a specific time frame for creating weights for the end-of-life file. There are a couple of options for how you can handle weights, but you could, for example, use the weights produced for the last core interview that the respondent participated in. But now we'll get back to our analysis. So if we want to test whether males and female estimates are significantly different, we can use a command called test, which is called a post-estimation command, meaning you run it after you've created your estimates. Here we've created mean estimates of death by cancer over death location and gender. So we'll look at whether there's a statistical difference of dying from cancer between men and women who died at home and between men and women who died at a hospital. So if we run this and test for a difference between men and women who died at home, which is subpopulation 1 for men and 2 for women, Stata will perform an adjusted Wald test. We'll see that the probability greater than the F statistic is 0.1641, which is not statistically significant. So we cannot say whether there's a difference of dying from cancer between men and women who died at home in our sample. If we test for a difference between men and women who died at a hospital, which is subpopulations 3 for men and 4 for women, then we get a probability of 0.0000, which is statistically significant. So there is a difference of dying from cancer for men and women who died at a hospital for our sample. So that concludes the first research question. For our next research question, we're going to look at what factors increase the likelihood of having a living will at the time of death. To get to the bottom of this, we're first going to run tabs of several variables, the first being whether the respondent had a living will at the time of death. We're also going to look at multiple covariates, including the age at death, year of death, whether death was expected to occur, whether the respondent was receiving help from someone for ADLs or IADLs. We're also going to look at a few doctor-diagnosed disease variables available in the Harmonized HRS end-of-life dataset and decide the best one to use. We'll use cancer as an example here. And finally, we'll run a tabulation of education level. So if we run this in Stata, we'll see that approximately 43% of people in our sample had living wills at the time of their death. The average age at death was nearly 79 years old, and we have years of death ranging from 1992 to 2014 because this data set goes through HRS Wave 12. Now, when we look at whether the death was expected in RADEXPEC, we see that it was expected nearly 60% of the time. And we should also keep in mind that this variable isn't a binary yes or no for our analysis. If we look at whether someone helped the respondent with any ADLs or IADLs in their final 3 months of life, we see that 73% received help with at least one activity. So now we get to these health variables. And first we have RALCANCRE, which indicates if the respondent had ever had cancer as of their last core interview. Sorry about that. These RAL health variables take the report of ever having a condition from their last core interview wave and contains no information from the exit interview itself. So we see approximately 25% reported ever having cancer as of their last core interview. Now we'll look at RAXCANCR, which indicates if the respondent had a new report of cancer between their last core interview and their death, and we see that about 13% did. The RAX health variables that don't end with E will tell us about the development of a condition between their last interview and death. For our last health variable, RAXCANCRE, which indicates if they were ever diagnosed with cancer in their lifetime. So we have about 38% of respondents who have been diagnosed with cancer at some point in their lifetime. We'll be looking at these RAX health variables that end in E for this analysis today, because being diagnosed with one of these conditions at any point in their life may influence whether they had a living will at the time of their death. And finally, we're looking at a harmonized education level, and we see that approximately 27% of people in our sample have less than upper secondary education, About 55% have upper secondary and vocational training, and about 18% have tertiary education. We'll keep in mind that this variable has multiple categories as well. So we're going to run a regression to figure out what factors increase the likelihood of having a living will at the time of death. To do this, we're going to use a command called regress. Then we're going to put our y variable or dependent variable, RALV will, followed by our x variables or independent variables. You'll notice that we have an I dot in front of RA gender, RADEXPEC, and RAEDUCL, and that's because they're not 0-1 binary variables. RA gender is coded as 1 and 2 for male and female, and RADEXPEC and RAEDUCL have multiple categories. So including the I dot will make the first category the base category, and it will automatically create dummy variables for the other categories for the purposes of this regression. Now, if we run this in Stata, we'll end up with our coefficients, standard errors, t-scores, p-values, and 95% confidence intervals for the coefficients. We can see that being female, being older, and dying in a later year all slightly increase the likelihood of having a living will, while having an unexpected death actually decreases the likelihood of having a living will. Now, when we look at our variables that indicate health, we find that each of these has a positive impact on having a living will, but our stroke variable is not statistically significant. Lastly, we see that having more education increases the likelihood of having a living will more than any other variable so far, and it does so in a stepwise pattern. So with more education, the more the respondent is likely to have had a living will in our sample. So that's going to wrap things up for us today. We hope you learned a lot about the HRS exit interview and our new Harmonized HRS end-of-life dataset, which is coming out extremely soon. If you have any questions or comments, visit us at g2aging.org or email our help desk at help@g2aging.org. We can help if you have specific questions about a harmonized dataset, or if you have difficulty finding something, or in figuring out how to get started. I'll also mention that the slides, a video recording, and the Stata code from today's webinar will be available on the Gateway to Global Aging website in the next couple days. So in case you want to watch it again or send it to a colleague. So this will be found in the documentation page under recent presentations. And if you're looking for an example of a core interview cross-sectional analysis using SAS, I suggest you check out the example SAS code provided under the August 2018 webinar. I'll also take you back to the downloads page and show you that this first column is where you'll be able to find the links to the Harmonized HRS end-of-life dataset, codebook, and Stata creation code in the next few days. So we want to thank you for joining today's webinar, and we hope that you find the harmonized datasets useful. After the webinar, you'll be sent a short survey where you can provide feedback or tell us about what topics you'd like to see in future webinars. We're always trying to improve our offerings to be relevant to you, so please fill the survey out. We're now available to take any questions that you might have, which you can do in the chat window or using the question box. I'll be here for as long as there are questions, but if you're leaving us now, thank you again for attending and have a wonderful day.